Hi, my name is Tracy. I am the Med Surg RN that's going to be giving you handoff report on patient Millie Larson. Millie Larson is an 84-year-old female who is widowed and has one daughter. Her name is Dina. She originally admitted to our facility, our Med Surg unit, for dehydration and UTI. Millie has a past medical history of hypertension, glaucoma, elevated cholesterol, osteoarthritis of the knee, osteoporosis, diabetes mellitus, and stress incontinence. While she was on our unit, she did get IV fluids and antibiotic for the UTI. Her UTI has resolved. She still does have a poor appetite and is underweight. She has a sacral wound that has purulent drainage with a foul odor. We did do wound cultures and they came back positive for Staphylococcus aureus, methicillin resistant Staphylococcus aureus, I'm sorry. She now presents on my assessment with a fever of 102, productive cough, difficulty breathing, and complaints of pleuritic chest pain. Her respirations were 26 per minute, her heart rate was 60, and her blood pressure was 98/66. Her oxygen saturations are 90% on 6 liters via nasal cannula. I assessed her lungs, and they were noted to have rhonchi and scattered crackles throughout. She does remain lethargic, and she is not eating well. Her provider was notified. He ordered a chest x-ray, which radiology read. She has hospital-acquired pneumonia. They did a CBC, and it was noted at 22,000 on her white count. The provider was then notified again to transfer her to the specialty unit, along with these new orders. New order to receive sputum specimen and obtain blood cultures. Increase her O2 of 6 liters per minute to a high flow rate via nasal cannula. And keep her oxygen saturations above 92%. Normal saline solution at 100 milliliters an hour. Ciprofloxacin, 400 milligrams IV in mini bags every 12 hours. And acetaminophen, 650 milligrams orally every 6 hours as needed for temperature over 101. Toradol, 30 milligrams IV, PRN every 6 hours needed for pain. Albuterol, respiratory nebulizer treatments are supposed to be given every 4 hours, and PRN is needed. And then we are to assess her respiratory status every shift. We did get the blood and sputum cultures obtained. The IV is infusing at 100 milliliters an hour with normal saline. She just finished her first dose of ciprofloxacin. She's not complaining of any pain at this time, so she's not had any Toradol. I did give her acetaminophen for her fever. She is to have her catheter stay in place. The provider wants strict INOs on her, so we need to make sure that it stays in place. Her intake so far has been 300 milliliters IV fluid. She's only taking about 50 milliliters and some sips in as far as orally. And she's had about 200 milliliters of yellow, clear urine out in her urinary drainage bag. Going forward, I just suggest that we continue to monitor her respiratory status, her fever, continue her wound treatments as ordered, and notify the MD if there is any change in her status whatsoever. If you have any questions, again, my name is Tracy, and you can call me on this Med Surg unit. My extension is 136. Thank you.